Hello, my name is Dr. Nancy Nelson, and I'm a pediatrician at Daniels Health Center in St. Peter. I grew up in St. Louis and went to the University of Missouri to college and medical school, and then did my pediatric residency training at Marshfield Clinic in Wisconsin, and liked being in Wisconsin and Minnesota. And after training, took a job at Buffalo Clinic in Buffalo, Minnesota, where I was a pediatrician for 24 years, doing all of the birth to 18 hospital, tending deliveries, outpatient care in a great community. But it became a point where it was time to just hone down to outpatient pediatrics, and that wasn't an option there. So I moved, and my family moved to Corvallis, Oregon, where I practiced for about 7 years doing outpatient work and full-time teaching residents. And then it was time to move back where my kids were settling in Rochester and Minneapolis. And I, I I love being a pediatrician because one, I get to work with kids, but I also get to work with families, and I have multiple roles. I'm not just doing medicine and taking care of sick kids, but I get a chance to be a support person for parents and families. I get a chance to educate, and I love to be an educator, to teach. I get to be someone who's a reassurer, and as well as the enjoyment of just watching kids grow up, and they brighten my day. So all those things make it something I've loved all along, even when it's not always an easy job. It feeds me. It literally feeds me, my soul. And so, yeah, I can't imagine myself doing anything other than being a pediatrician. I really love all areas of pediatrics. I really like healthy kids. I like kids with special needs, teenagers, even mental health, and kids with little neurodivergencies, autistic children, children who struggle with ADHD. But there is a special place in my heart for truly special needs kids. And I think both the kids themselves and how just the littlest things can bring such joy to them. Just, you know, things that we all take for granted for both the kids and their families are can be huge. I also have learned so much from working with these families, their patients, how they approach their their differently abled children, and it just gives me joy to watch and to interact and to be a support people for these really special kids. One of the things I like here at Daniels is we have what's called a medical home model, which basically means we kind of serve as a hub for families of kids who have more complex issues. We have a clinic manager and we have a care coordinator that are excellent. They have a lot of experience, and they help to provide community resources and help bring if you have a lot of subspecialists involved, a lot of caregivers, a lot of therapists, they help to help coordinate that. And I love that model of practice, that we can be that hub for families. So in kids and families with special needs or complex medical care, I really like being in this location where I have a support team to help be that for the families. And